What's one thing you would never do as a bariatric surgeon?
Well, one thing I will never do is do a procedure or agree to having a procedure done on a patient without their full involvement and their agreement on. So we call that an informed consent process where patients know about the risks of not doing the surgery and also the risks of having the surgery and what the downsides are, and agree that they are willing to comply with and work with the surgeon to get the best results.
Hey Andrew, what's one thing you wouldn't do as a bariatric surgeon?
So I think the one thing I wouldn't do is tell patients that surgery is magically going to cure obesity. Well, patients certainly do lose weight with surgery, and it's still the most effective intervention for obesity. Just like the way people probably used to tell you that all you needed to do is do some exercise and eat less, which has proven many times to be false. The opposite is also true in that just because you have surgery doesn't mean that you can ignore the lifestyle aspect of things.
What's one thing you wouldn't do as a bariatric surgeon?
Oh, look, I think the one thing that I wouldn't do is to judge people based on their size, because I think that there is so much backstory that you don't know, and it's very kind of easy to jump to conclusions, but that kind of judgmental attitude I would just never apply to anybody that I met in my life.
Hey Ara, what's one thing you would never do as a bariatric surgeon?
As a bariatric surgeon, I'd never do a crash diet. Losing weight too quickly is a disaster. You don't want to lose your muscle mass. It's very important to maintain muscle mass, and it's something we make sure with our patients they're losing weight gradually and maintaining that muscle mass.